what are the important aspects of effective communication? So we talked about being an active listener. Anything else that you want to mention that's important?
Yes, I think I'm kind of old school, and I'm one of those people who thinks that words are actually important and they mean something. They actually make a difference. So what I would say is just be very careful with the words that you use. Try to stay away from words that have maybe sinister pathologies. And one example, and I know sometimes we use these words like lesion, and so if I'm talking to a patient and I say, well, this is how your lesion is behaving, when you hear the word lesion, what are you thinking? Because I'm thinking something really sinister. Oh, maybe I better get my effects in order.
Yeah.
So I try to stay away from these hot button words like that. I would also recommend that using simple words and words in a language that the patient understands. So I think those are some important things that we can be considering for effective communication. The other thing that we can do, and we talk a lot about this on the diploma program, and that's asking neutral, non-leading questions. So how many times you have a patient in front of you and they generally want to give you the answer they think you want to hear. And many times they want to do this because they want to please you. But that's not going to help you in any way come to a conclusion about what the problem is. And so I'll give you an example there. I want to find out what positions and movements make this person better or worse. And I ask the question, does your back hurt when you bend forward? And I'm shaking my head, yes. And the patient's thinking, oh, so my back is supposed to hurt when I bend forward. And then what do they say to you? Yes. Well, now you've led the patient. They're going to give you the answer they think you want to hear instead of the truth. When in fact, what you want is the truth. So there's a better way to ask that question. So instead of saying, does your back hurt when you bend forward? What about, when you bend forward, are you better, worse, or no different? That's a neutral question. You've given them a choice. Now, what the patient knows is none of these is correct except for the correct answer. They don't feel obligated to answer in a certain way. But and then there's a problem sometimes. Some patients will say, I never bend forward. I was told never to bend forward. So in my head, I'm thinking, how can you possibly get through your life without ever bending forward? But that's this. And what you want is this. So how do you do that? You have to make it relevant to the patient that's sitting in front of you. So instead of being argumentative or clashing, I might say, oh, well, let me give you an example. Let's say you have to bend forward to brush your teeth, or you're bending over to tie your shoes. Does that make your back better? Does it make it worse? Or does it have no effect? Now you've made it relevant to their lives, because everybody has to put their shoes on. Everybody has to get dressed. Most people, you would hope, brush their teeth. These are bending forward types of exercises, and they're relevant to the person that's sitting in front of you. So now you have three things. You're an active listener because you're not interrupting the patient with what you want to ask. You've chosen your words very carefully in language that the patient can understand, and you've asked them a neutral, non-leading question so you get to the truth. So those are three really effective communication things that you can do to be effective with with the person that's sitting in front of you and make the patient feel like they're not being rushed.